when you want to stop a bleed, being thrown into an emergent situation where you know, you are really worried about losing a life. The nice thing about this training setting is you can walk through it stepwise. You can do it in a more essentially casual fashion, and be able to ask questions and move through it in a very logical and slower manner than you might in a trauma situation.
So they go through basically the upper extremities, the lower extremities. They go through the chest. So they look at all the anatomy of the chest and the heart and the vessels there. They go through the neck as well. They also then will look at the pelvis and the abdomen so that they're able to basically experience all the different components of the body and be able to do those emergent trauma situation surgical procedures. They also did some fasciotomies, which would be something that they might necessarily not do in an OR, but maybe even at the bedside.
I am a private practice general surgeon in Lee Summit, Missouri. I currently also am the program director for the KCU St. Mary's Blue Springs General Surgery Residency. This is a course where you can come and actually do hands-on work in procedures that maybe trauma surgeons don't see on the everyday. So it's a good practice for residents to potentially see procedures that they haven't seen before, and even attendings come for a refresher course from time to time. As for the students, this is an excellent way for them to see anatomy that they wouldn't otherwise see. So on a daily basis, they come down here to the anatomy lab and maybe they dissect out the carotid artery and they get to see its relationship to everything else around it. But in this course, we present it as someone comes in with an injury to the carotid artery. So what do we do to get down there, get it controlled, and get it fixed? So it really brings anatomy to life.